Hi, I'm Natalie Schwadka from the University of Colorado Anschutz Medical Campus's Center for Health, Work, and Environment. In this video, I will be speaking about a study that my colleagues and I recently published in the American Journal of Public Health on the topic of engaging hospitalists in shared leadership for health, safety, and well-being. This was a collaborative qualitative research project with colleagues who are members of the Home Run Research Network of academic hospitalists across the US. Engaging hospitalists in workforce health, safety, and well-being is important for a few reasons. First, they need help. They work in shifts with high complex patient loads, resulting in burnout. This was especially apparent during the COVID-19 pandemic, where they cared for many hospitalized patients. But the good news is that they are poised to lead hospital safety and health well-being efforts, as they are experts in patient safety, quality improvement, and case coordination. So our question was, how can we engage them in this? And our first step was to understand their current perspectives on health, safety, and well-being and level of engagement, based on whether they were in a formal leadership role or not. Our sample represented academic hospitalists who were members of the Home Run Collaborative. We conducted focus groups with 17 formal leaders and frontline hospitalists in the fall of 22 and the winter of 23. Before the focus groups began, we asked all participants to complete a short survey. The focus groups and survey asked about their general perspectives on health, safety, and well-being, how their teams share responsibility for health, safety, and well-being, and whether they consider to be leaders themselves. And we used rapid qualitative methods to analyze the focus groups and descriptive statistics to analyze the survey responses. In this effort, we learned three broad things. First, hospitalists perceive a variety of threats to their health at work that really threaten the sustainability of their careers. Hospitalists can readily talk about the health, safety, and well-being of their patients, but they really struggle to put into words what it means for them. However, when I pressed them, they commonly discuss things like violence, stress, ergonomic issues, workload, time pressures that lead to multitasking, among many other factors that relate to their health at work. This was juxtaposed with their sentiment that there was no systematic support for their health at work. The way their work is organized, such as staffing levels and workload, doesn't really support their health. They're also not attached to specific hospital units that tend to receive more support, such as nursing units. And finally, they noted that smaller hospitalist groups suffer more because they have fewer resources than the larger ones. So the question is, who is leading health, safety, and well-being efforts for them? And this is where perceptions started to differ by whether someone was in a formal leadership role or serving as a frontline hospitalist. Formal leaders recognize their responsibility for their team's health, and they also recognize the value in developing the leadership of others. Frontline hospitalists were very reluctant to describe themselves as leaders, with one even noting that they don't have the time. But really, most were unsure what this role would entail for them. This effort highlights the importance of first defining and educating hospitalists about what health, safety, and well-being is for them, as well as what health, safety, and well-being leadership would look like for them. For example, does leadership look the same for formal leaders and frontline workers? What are their roles and responsibilities? How can they share these responsibilities? And how can we integrate this into their already very busy schedule? And once we get a handle on this, the second thing we need to do is to develop a strategy for guiding leadership development amongst this segment of the healthcare industry to help them put concepts into practice. We invite you to read more about this study in our paper published online at the American Journal of Public Health, which is freely available to read online. And finally, I would like to acknowledge the National Institute for Occupational Safety and Health for funding this work, Lee Newman for his mentorship, and the Home Run Group for their support.